Hi, I'm Alex Larson, and my topic for my project was I explored accessibility and the inadequacy with healthcare in South Africa. So, in general, I feel as though, like through my research, we as Americans take our access to easy healthcare for granted. And in South Africa, healthcare is very scarce, and adequate healthcare, especially, is very scarce. As a lot of people have talked about already, there's a two-tiered healthcare system in South Africa, the private sector and the public sector. Public sector covers almost 80% of the population, whereas only 20% 20% of the population then goes to seek private healthcare. Then those people that are seeking the private healthcare, those are the wealthier, more upper class, and most of you can obviously guess who makes up that sector of the population. Most of the white class or the white population of South Africa. Private healthcare is commercially run, and therefore it attracts most of the doctors and nurses and like medical personnel that obviously are needed for the healthcare. Whereas the public is like the totally opposite end of the spectrum, and it's completely underfunded, mismanaged, and just totally inequitable in every sense possible, and also inaccessible to a lot of the population. The World Health Organization, I found a statistic from them that said the total expenditure on public healthcare doesn't even cover half of what it needs to serve that 80%. In specific, the public sector spends about $140 per capita, which I did the math, it's about $560 million. And then the private sector spends $1,400 per capita, which is obviously, you can know that's a vast difference. And then if you look at the U.S., a article that I was reading from Forbes magazine said that in 2014, the government spent $3.8 trillion on healthcare, and that was like an all-time high that we've hit for, ever. And so this difference in healthcare is the difference between saving someone's life and not saving someone's life. So with my topic, I then decided to go and explore the types of health issues that are occurring in South Africa. So HIV, AIDS, and tuberculosis are enough of a problem that it then puts South Africa in critical need for healthcare. So obviously, like I said earlier, good doctors, but because of the discrepancy between public and private, it's pulling all those doctors to one side. 70% of doctors are the ones that go to private, and 30% go to the public sector. That's really not their fault, though, because they're going where they're going to prosper as professionals, and they're going to get benefits themselves. Because inability to pay and actually distance are huge barriers for a lot of people when it comes to healthcare in South Africa. But that's why there's something called Unjani clinics that are being created in South Africa. That's an alternative to the inadequate public healthcare system. And it's not only good for the healthcare system, but it's aimed to boost the economy, because it will it'll obviously provide jobs, at least 3 jobs per clinic. And their goal is within the next 3 years, they'll have 90 clinics across South Africa. So Unjani clinics in general are just one example of how there's helping to provide widespread health care to fix the inaccessibility issue. I personally think from all my research that this inaccessibility has to do with the residual effects of apartheid, because one of the residual effects is like the widespread poverty and people living outside of town due to things with like the Group Areas Act and stuff. And also, travel times is also a huge issue that people have when it comes to healthcare, because since they live so far away, people can't afford to not only take the transportation or just to go there in general. So I'm a nursing major, and it's the reason why I decided to do this topic. And in general, I feel that everyone has the basic right to access and receive health care, and I thought a lot back to the Freedom Charter and the Universal Declaration of Human Rights, where, as other people have mentioned too, Universal Declaration of Human Rights specifically stated how everyone has a right to a standard of living with adequate medical care. So yeah, basically, obviously, you can see that there's a huge gap between the two, and there are there are efforts being made to fix it, but it is something that is a relevant problem.
In the beginning part of your presentation, you mentioned that there's easy access to healthcare in the United States.
Mm-hmm.
Is that accurate? Is healthcare available to everyone in the United States?
I'd say a majority. That's obviously probably a very broad statement, but when I say that, I'm talking about a comparison as to, because of the state that South Africa is, like, if we are looking at an underdeveloped country versus a developed country, we have the, like, most people in this room, or everyone in this room has the ability, if they need to, just go to any sort of doctor's office, whether public or private, or even we have things like at a CVS, like a Minute Clinic, or like a Doc in the Box, whatever you want to call it. There's many options I feel like that we have that, and even people of all different classes can have have the opportunity to have access to healthcare, whereas in South Africa, because there's just not as much money that's put, as other people have talked about, there's not as much money that's put into the healthcare sector, whether it be public or private. It's having a huge impact. And there's other stuff that I want to talk about that I obviously didn't have time to, having to do more specifically with health problems and how that's affecting it as well. But yeah, I think when I make that statement, I'm talking more as looking at the developed versus the underdeveloped.